Ceftriaxone, a third-generation cephalosporin antibiotic. It is widely used for serious infections like meningitis, pneumonia, and sepsis. But like many powerful antibiotics, it doesn't always play nicely with other drugs. In this video, we'll explore the key drug interactions of ceftriaxone, starting from the most dangerous combinations and moving down to the less severe ones. You'll learn not just what to avoid, but why, with clear explanations for every mechanism. Let's start with the most dangerous interactions, classified as risk X, meaning avoid this combination. These are cases where the drug interaction is so severe that the two should never be used together. The first one is intravesical bacillus calmette-guerin, BCG vaccine. Intravesical simply means within the bladder. It is a medical treatment where a BCG vaccine is delivered directly into the bladder to stimulate the immune system to attack cancer cells in early-stage bladder cancer treatment. Antibiotics like ceftriaxone can kill or weaken the live bacteria used in BCG therapy, reducing its effectiveness. When antibiotics are given at the same time, they neutralize BCG's intended immune-stimulating effect, making it ineffective. Second is cholera vaccine. The cholera vaccine contains live but weakened bacteria. Antibiotics can kill these organisms before they trigger immunity. Therefore, patients on systemic antibiotics should avoid the vaccine and wait at least 14 days after stopping antibiotics before receiving it. Fecal live microbiota, both oral and rectal forms. This treatment involves transplanting beneficial gut bacteria to restore intestinal balance. Antibiotics like ceftriaxone can destroy these bacteria, completely defeating the purpose of the therapy. Now, let's move to risk D interactions where caution is needed and therapy modification should be considered. Intravenous calcium salts. This one is critical. Ceftriaxone can bind with calcium, forming insoluble precipitates, tiny solid particles that can block blood vessels. In neonates, this can cause life-threatening complications like cardiopulmonary arrest. Therefore, ceftriaxone is contraindicated in neonates who are also receiving IV calcium-containing solutions. For older patients, always flush IV lines between giving these drugs to prevent interaction. Ringer's injection. This IV fluid contains calcium, so the same risk applies precipitation with ceftriaxone. Again, avoid concurrent use in neonates and flush the line between doses in older patients. Another one is Bacillus clausii. This probiotic is often prescribed to maintain gut flora during antibiotic therapy. However, antibiotics like ceftriaxone may kill these beneficial bacteria, reducing its effects. The best approach? Take Bacillus clausii between antibiotic doses, not at the same time. Next, we have sodium picosulfate. This medication is used for bowel cleansing before procedures like colonoscopy. Ceftriaxone can reduce its effect by altering gut bacteria, which are needed to convert the prodrug sodium picosulfate into its active form for laxative effect. Use an alternative bowel prep if antibiotics were recently used. Typhoid vaccine. Only the live attenuated TY21A strain is affected. Ceftriaxone kills this live bacteria, preventing immunity from forming. So, postpone the vaccine until 3 days after finishing antibiotics. Or start antibiotics at least 3 days after the last vaccine dose. Finally, let's cover risk C interactions, where the combination can be used but requires monitoring. Aminoglycosides. Ceftriaxone can increase the kidney-damaging effects of aminoglycosides and may also lower their blood concentration. When used together, as often done for synergistic effect in severe infections, monitor kidney function and drug levels closely. Vitamin K antagonists, like warfarin. Cephalosporins can enhance the anticoagulant effect of these blood thinners, increasing bleeding risk. Monitor INR closely when using them together. Probenecid. This drug can increase ceftriaxone levels in the blood by reducing its excretion through the kidneys. It's not dangerous but may require monitoring for side effects. And keep in mind, there are many other risk C interactions beyond these examples, including some involving immunotherapies and probiotics. The key takeaway? Always check for potential interactions before prescribing or administering ceftriaxone. And that's your complete guide to ceftriaxone drug interactions, the combinations to avoid, modify, and monitor. If you found this breakdown helpful, don't forget to like, subscribe, and share for more clear and clinically accurate pharmacology videos.